Welcome to Entrepreneurs in Healthcare. I've come to realize that entrepreneurship discussions are long overdue in medicine. I'm pairing up with voices from healthcare that value entrepreneurship and that are willing to come on the screen with me and hold a discussion. I'm hoping that hosting these conversations will open up pathways to making progress in medicine and not making entrepreneurship a bad word. Join along on this series as we dissect entrepreneurship, healthcare, and everything in between. Hi, everyone. It's Donna Coriel from SoMeDocs, and I am excited to host yet another episode of Entrepreneurs in Healthcare. So Dr. Diana Mercado is sitting across from me virtually. And Diana, I'm going to actually have you introduce yourself and tell our audience what it is that you do, just all about you.
Awesome. So thank you for the invitation. I'm Dr. Diana Mercado-Marmarosh. I'm a family medicine physician, and I'm also an ADHD life coach for healthcare professionals who are ready to leave work at work and want to be present at home and are ready to create systems that embraces their ADHD gifts.
You know, Diana and I met even before the conference that's coming up that we're going to mention here because Diana's going to play an integral part in being in the speaker lineup. So we're super proud of that. But we also met just on Facebook in general, and you became a network member of SoMeDocs, and thank you for that, on this podcast. Let's dive into that a little. Well, first, before anything, is the question of the hour, and that's, is entrepreneurship in healthcare good or bad?
Yeah. I think it's good because it allows us to practice medicine in a different way. And what do I mean by that? Of course, there are some people who are in private practice and they have to level their skills in entrepreneurship in order to be able to market themselves and do all that. But I am in a very unique role where I'm actually employed by somebody else. And so my entrepreneurial journey came from my coaching side of it. And I never intended to pick something else in addition to being a full-time physician, but I started to see that as I was embracing my own ADHD, that there was a gap that the medicine was not filling. Like there was not the executive function skills that were being taught through coaching. So I decided to fill in that gap. And at first I thought maybe I'll do it for my patients, but I realized that if I helped people like myself who were physicians who just didn't know about this, they might decide to stay in their own careers longer, and because they didn't feel overwhelmed or shortchanged. Now, entrepreneurship, there's not a step-by-step thing like that you get when you go through medicine. They tell you, okay, well, you first have to go to medical school, then you have to do residency, then you gotta do, this and this and this. Like, there's no like script. Like you have to think that all roads will eventually lead to money if you're wise. But along the way, you might, because there's not a script, you are gonna have to learn to trust your instincts, and you're gonna have to learn to trust the network that you have, because you don't realize that those relationships are the ones that are gonna open doors to help you to get to the next step. And you always feel awkward in doing everything that you're doing because nobody tells you do A, B, and C. And I remember the first time I ever gave like a webinar, I didn't even know how to use Zoom. So I stumbled trying to figure out how to do a presentation and all that. Yet I did it because I felt like the message that I was going to give was more important than how it looked, even if it was clunky. So entrepreneurship helps us to grow and grow a lot because some of us are afraid of failure, but you realize that the people who are successful in whatever they do, it's not that they haven't failed. They just have failed a lot more because they tried a lot more times. But it's not that they failed. They just acquired new information along the way that allowed them to keep going. And so in entrepreneurship, you really grow in many places. Like you grow personally, your communication skills have to grow, your writing skills have to grow, but your money skills have to grow too. You have to be aware that just like you can earn, you can spend. And so if you're not looking and learning about spreadsheets or what's coming in and what's coming out, you might get yourself in trouble because you put all this forth effort, and if you're not careful, we can easily overspend, especially if you have money, like if you have a steady income from an employed position. You don't, your business sometimes can become like a hobby, and you got to be careful with that too.
Yeah, there's really no playbook where it comes to entrepreneurship. And I think a lot of physicians, especially just because they're our particular colleagues, when they pivot and they add on entrepreneurship on the side, I think a lot of us feel lost. So, yes, I agree with that as well. Um, Back to what you said in the beginning, you were mentioning about ADHD and physicians. And you sort of mentioned ADHD almost as a cause of burning out and not being able to succeed. Is that a correct assumption? And how prevalent do you think that ADHD is in our profession?
Yeah, so I was actually told when I was an attending that I had outgrown my ADHD. And so I was told by a psychiatrist I didn't need medications because I should know better as a physician. I should know that you outgrow ADHD. That's what they told me. And so I didn't know that piece of information. I took it to heart, but I was really embarrassed about that information that I didn't know. I was in my head about like, okay, as a primary care physician, I should have known that. How come I didn't know that? And so I neglected my ADHD diagnosis. And I thought, well, I'm just going to have to figure out a different way because it's not my ADHD that's keeping me from doing different things. So I told myself. But when the pandemic hit, I couldn't stop ignoring that it was maybe my unmanaged ADHD that was causing me to work 20 to 30 hours unpaid outside of work doing the administrative stuff that I was too embarrassed to share with others because I had 200 to 300 open charts, 600 labs. As a primary care physician, I didn't have any problem hyper focusing in my patients and giving the diagnosis because I love that part of it. But the boring part of it was the charting and the not having enough time to do the things that I found, when did I find time? And so I started to wonder whether my ADHD had anything to do with this time blindness that I had because even though I would see all my patients, like I was always 2 to 3 hours late, like per day. And I just thought that was the small price to pay to have the privilege to be able to take care of my patients. And I tried to, not show how hard I was working because I thought, well, I don't want them to think I'm doing it wrong. But as I dived into coaching, life coaching specifically, it was pointed out to me that even though I was trying to running, I was trying meditation, they told me, Diana, you're still all over the place. You need to see somebody. They're like, don't you trust somebody? Like, who do you refer people to psych? And I said, okay, fine. So I talked to them again. I got on medications that was on 2021, and wow, like life changing again. And I'm not going to say that it was only meds because I started to invest in my mental health therapy, coaching, group coaching for ADHD, like all the things. And then I decided that I needed to explore this more. And I started to talk about it. And that's when people started to reach out to me that they wanted my help because they were seeing me slowly accomplishing not being so late. And yes, in a study in 2016, 30% of US medical students said they self-reported that they had ADHD. And so it is very prevalent. And in the last 3 years that I've been coaching physicians with ADHD and some medical students and some healthcare professionals, but mainly physicians, I would say I've coached about 120 physicians in the last 3 years. You would think that most of us are just like in internal medicine, maybe like the ER, but no, like everywhere. Pediatricians, pain management doctors, psychiatrists, family medicine, like pathologists. Like I have helped all specialties and people of all ages, because sometimes they don't even get diagnosed until menopause or until one of their kids gets diagnosed, and then they realize that this is genetic and it didn't, the apple doesn't fall that far from the tree, and then they start to see some patterns. But I always tell people, like, it doesn't matter how old you are, like, to learn new strategies. Hopefully you're like my grandma that lived to be in the 90s. So even if you're in your 50s, like that's still 40 amazing years that you can pivot and fulfill yourself. And I'm not going to say that ADHD is all bad, because it's how you reframe it. Because when I look back, my leadership skills, it was probably because I was, impulsive, and I started to say out loud what other people were thinking and they didn't say, or my thinking outside the box to try to change the systems that weren't working, probably, was the reason I kept getting promoted, because I kept thinking of novel ideas where most people give up after the second time of trying something. I was like, no, this is something I want to do. We're going to figure this out. And so I think that being persistent, and maybe some people call it stubborn, but to me, that's goal oriented, and that's passion, and that's energetic. And yes, do we start thousands of projects? Of course, because we're so excited. But then we lose track of time, or we get bored. And so that's where you have to realize, if something is really important, who can I then delegate this to so that the task gets to the end line, if it's still important for you. But the question was, do I think this is a problem? It can be a problem if you are not even aware that you or your colleague might have ADHD, because undiagnosed ADHD and untreated ADHD can really decrease a person's life expectancy about 20 years. Why? Because you're late, you're speeding, you're going to get in a car accident, you're chasing dopamine, you might be skydiving, or you might be different things that you're not aware, because of that impulsivity can get you into trouble. And if you don't know that you have this quick saturation of task switching and emotional dysregulation, impulsivity, you might cause miscommunications with your colleagues or your spouse. And so you might be more likely to end up, being fired, getting a divorce. Like you might, again, the time blindness might cause you to not be aware that you missed a meeting that was very important, and that could have gotten you into trouble. You forgot to submit your CME stuff, or different things that maybe don't seem that problematic, but over time you get labeled as, not a team player, or only hyperfixated in one area, or, abruptly interrupting others. So again, if you're not aware that your strengths and your weaknesses can cause miscommunication, you might end up being fired, or you might end up being divorced because you weren't aware of that. And again, if you don't realize that you're using alcohol or sugar as a way to increase that dopamine that maybe is low, because that's what ADHD is, it's low dopamine, you might not realize that that's why you're
and I needed to give Diana virtual CPR. That meant that I needed to figure out what was wrong and then get Diana back on our recording. I did, and we had a laugh. All right, we're back, and my Wi-Fi let out, and so Diana was so kind to forgive me for that. Literally, my Wi-Fi went out, so she froze, and the entire Zoom just stopped working. And I got it to be back up. My Wi-Fi is back up. Don't know why. Um, it's that like nebulous part of life where you literally are like clueless and your hands are tied because if it goes out, like it goes out, there's nothing I could do. The router's fine, it was working. All right, so back to us. So my apologies to the listeners as well, because it did cut Diana off in the middle of her thought. While you were talking, I was thinking of the following question. Do you think that there are instances where doctors are simply overwhelmed by the demands that are placed on them by the healthcare field today and sort of blame their inability to juggle 1,000 things at once on ADHD or another neurodiverse diagnosis when in fact they're just not able to properly juggle 1,000 tasks at once?
Yeah, that's a really good question.
We'll be right back. Our Neurodiversity Conference is a conference about people who think differently. Take a listen to our lineup.
Hey, it's Crystal, and I am so excited to be chairing this conference for and about neurodiverse physicians. We're going to talk about some of the different neurodiversities and how they can or potentially can impact your treatment plan.
My presentation will be on sleep strategies for neurodivergent physicians. We'll talk about how the unique gifts and challenges affect sleep.
And I'm excited to share about mindfulness, how to quiet the chatter in your mind and feel more calm and present.
Having a different brain predisposes you to problems and changes some of our novel treatments. In my lecture, you'll learn what those treatment options are, how they differ in people with neurodiversity, and how we can differentiate burnout from actual psychiatric illness.
Whether you have ADHD or not, you can join my class to learn how to optimize your executive function and end procrastination loops.
There are a lot of people out there who are on the spectrum but don't know it. They know they're different, but they don't understand why. And that's what I'm going to be discussing with you.
It's important to remember that this concept of normal or neurotypical is not a value judgment. It's just the most common type of brain, so that's the kind of brain that society is structured around.
To better recognize and support your colleagues who may have ADHD, and that includes yourself as well as perhaps people that you're leading if you're a physician leader.
You can catch this event live for free or access the footage after it's over anytime by purchasing a ticket on our website at doctorsonsocialmedia.com/conferences. Now back to the show. Do you think that there are instances where doctors are simply overwhelmed by the demands that are placed on them by the healthcare field today and sort of blame their inability to juggle 1,000 things at once on ADHD or another neurodiverse diagnosis when in fact they're just not able to properly juggle 1,000 tasks at once?
Yeah, that's a really good question. I mean, when somebody gets diagnosed with ADHD, there's different ways, right, of getting diagnosed with ADHD. But one has to make sure that it is not a diagnosis that happens in the background of trauma, right? Or it's not a diagnosis that happens when you have hypothyroidism or you have anxiety, depression, because they can, of course, all coexist. But when I got diagnosed with a test that was a neuropsych test. Now, not everybody needs that, of course, but I was a medical student and they wanted to get the diagnosis, and that was an 8-hour exam that I had to go through. But in general, how physicians used to practice back in the day, and even like if you look back in 1990, like physicians had a whole hour to talk to their patients and figure out what was going on. Today, if you're in primary care like I am, you have 15 to 20 minute appointments, And how do you do that when you have some patients who are literally on 20 medications, right? Like, and you're supposed to like what, address just one or two things, because then if they come with the things that they had, like you don't even know if they are following what all the advice you're giving them. And even if you did change stuff, did they actually remember what you changed? And so our attention span's a little bit different. And my setting, I sometimes got a phone call from the ER, or sometimes the nurse would knock in the room asking me to sign this, even though it was not necessarily something that needed to be signed in that moment in time. So there were several distractions that would happen. And then you hear, when you have some people that come and want to talk to you, like it could be another doctor, like that they're just new in town and they're trying to show you their services, or you have a drug rep, or you have somebody who's late, right? And now they just got here and they really want to be seen, and can you squeeze them in? Or, so it's just life. And so you are then asked to do this amazing note and click all the 1,000 little buttons in the computer to show that the EMR, you're compliant, right? And so it pulls you in so many ways. And then some of them have access to emailing you, right? Like, and why is the doctor not replying right there and then? I sent them an email like 20 minutes ago, but they don't realize you have 20 patients you're seeing right now, and their question is not at the top of the list. And so it becomes a problem where the expectations that you're asking of a doctor, if they really did what they needed to do, you would need like 30 hours in a day to work an 8-hour shift. It almost feels like that, because you're asking them to do a prior authorization on some medications. You're asking them to call another consultant to ask about this or that, to like overturn what they didn't cover for the hospital, that they really didn't think that they met admission criteria. So you're asking them to do all these other tasks that are not directly linked to primary care patient interactions, but they affect the patient, right? Because the patient doesn't want to go get stuck with a $10,000 bill, right? And so a lot of patients don't realize how much a physician is having to juggle. On top of that, somewhere in there you want to eat, somewhere in there you want to like, go to the restroom without feeling like, oh, I'm going to make this other person wait even longer, right? And so some things you can't speed up. Like, what am I going to tell the patient? Oh, you're suicidal? Oh, I'm sorry, your 10 minutes are up. Okay. Like, some things you just need to slow down enough to be present with the patient. And sometimes in being present with the patient, you are able to diagnose that heart attack, or you are able to diagnose that cancer, because you listen that they are telling you that they have this chronic cough that has been there, and you just don't think it's an upper respiratory infection, even though they don't smoke, and you decided, let me just check the x-ray, and all of a sudden you diagnose them with cancer, right? So I think a lot of people don't realize that emotional regulation is something we all can learn, and it is an executive function. And we have not been taught that to manage our emotions are important, because at least I got taught, conceal your emotions. Don't show your frustration. Like, a patient is always right. But I had to learn that, no, I first have to be the best. I'm the number one patient. If I'm not okay, they're not going to get the best version of me. And I had to learn that I had to set boundaries. I had to say no double bookings. I had to ask for a certain way of doing things. So the system is not going to change itself, but you have to find a way to practice medicine that makes sense for you. And if you can change the system, I was lucky that I was able to, because I was the clinical medical director and the chief medical officer where I work at. And whatever I needed to change for me, for you could call it ADHD accommodations, or you could just call it friendlier accommodations. I said anybody who's gonna come and see me, they need to have labs 1 week before they come see me, so that when I'm talking to them, I'm going over the labs. I'm actually going to ask them, are you taking this meds? Because sometimes they tell you they are and they're not. And so then if you're just calling them back to tell them what to do, you don't even know if they were really taking the meds or not. And you're just playing phone tag between you, the nurse, and the patient. And you don't even know if they got the message, right? So I started to implement systems that were for everybody. It didn't matter what provider they were going to see. Everybody was going to have their labs 1 week before. It became like a clinic-like system, right? And all the nurses were going to open the note, because sometimes we didn't even remember if we saw the patient or not, when it was such a busy day that you didn't even open the note because you got sidetracked. Then we were like 2 days later, did I see that patient? Did they come? Did they not come? So we decided to train everybody to do the same thing. Now, it took me about a year and a half of multiple negotiations to get virtual scribes, but now all 10 of our people have virtual scribes. And some people, like, I mean, now you just have to see 2 or 3 more patients, but your notes are done at the end of the day. It's not everybody can have that, but if you don't even ask for it, the answer is always no. So you just have to realize, how can the system support me a little bit different so that it can help the physicians, the providers, be happy, be more productive, but from a place of like, they're supporting me, not from a place of like, oh, I'm not even paying my own salary. Like, even though some of us get told that every single day, you're not meeting your RVUs, right? So I think the question was, can everybody have ADHD? Of course. Like, I think eventually we might all get diagnosed with that one way or another, but we act like it because of the way we're thrown into so many distractions. But you can clearly see somebody who has ADHD because the timeline. For me, 5 minutes or 45 minutes are exactly the same. It's amazing when I'm talking to you, but it's not so great when you're waiting for me, because you're like, where is she? Where is she? Right? And so that's when you have to realize that you have to use strategies. You have to use a timer so somebody can come and knock on the patient's room and say, hey, Dr. Mercado, do you need anything? And at that moment in time, I'm like, yes, I need a tetanus shot, or I need a UA, or I need you to give me these samples from the sample closet, and so it's an easier way to give me a clue that I need to be moving along. And then the patients know, some of them have ADHD, and I said, well, we're trying to beat the timer, okay? So I call it a quality improvement project. So you just learn to go with it, right?
I want to add here that you are taking part in our neurodiversity conference that is being chaired by Dr. Crystal Sedatis. Dr. Crystal Sedatis, the chair, got to choose the lineup of speakers, and she brought you in. So that's very exciting. I'm excited to be able to, run the tech and organize this conference, but also be present for your talk. Can you give us just a brief synopsis of what you're going to be teaching in your speaking slot?
Yeah, so I am going to be teaching people how to get unstuck with procrastination. A lot of us don't want to do stuff for multiple reasons, but if we don't realize that there are certain executive functions are tools that can help us to plan and complete any goals or any tasks. If we don't realize that emotional regulation, that means our ability to manage emotions. If we don't realize that task initiation, which is the ability to start something, or metacognition, which is the ability to think of patterns, right? If you don't realize that you have control over each of those functions, then it becomes obvious why we want to put off certain stuff. In general, people with ADHD are chasing something that is fun. We're chasing the dopamine. People without ADHD, they're more likely to do what is needed of them. Fun is, of course, they like fun, but it's not all motivational. Like they have a sense of responsibility. They have other things that drive them. But in general, nobody's gonna want to start a task if they feel like the task is too daunting or too boring or too big. And so if you don't realize that there's strategies to decrease the initiation of something, most of us don't start a task because we're like, I have plenty of time, or I don't even know where to begin. But if you know, okay, what if I count down? Like most of us jump into starting something if we count down. If we count up to 10, you get lost at 5 and you stop counting and then you move on. But if you count down, it kind of gets us into action. Like when we say 3, 2, 1, we feel like all of a sudden we have to get up and go and do something. So like little strategies like that seem silly, but they can really decrease that initiation step. Once we do something, once we start doing something, not as bad as we thought it was going to be, but the getting over the first hump of starting it is what keeps us like stuck. So sometimes using a timer, telling yourself, okay, I just have to do this for 5 minutes. Like I don't have to do this for a whole hour, just 5 minutes. I can handle anything for 5 minutes. And in those 5 minutes, it might be that, let's say you needed to start a presentation, right? Okay, what am I going to be presenting about? Let me look up an article or two. I don't even have to read it. I just have to look up the article or two. And then maybe tomorrow I will finally read that. And so like if you chunk it down a little bit more, the procrastination piece starts to go away. But with emotional regulation, everything we do is because of an emotion. Like, why did we marry that person? We thought they were going to be a great partner. Maybe we were going to have adventures together. Maybe they were smart, right? Why did you decide on that residency program? Oh, you thought it was the best in the country there. Then, why did you buy that specific house? Or why did you send your son to that specific school? So everything is because of an emotion. And when we're not checking our emotions, when we don't realize, oh, I can on purpose choose a moment of joy today by listening to this song or doing this meditation or taking a deep breath or deciding I'm not going to deal with this at this moment in time. I'm going to do something else. So if you don't realize that you have the ability to regulate your emotions, and that emotions are not good or bad, they're just a compass to help us to understand the world. And all emotions are needed, even though we all want to nobody wakes up and says, please sign me up for pain. Like I haven't met anybody who's like so excited about that, right? But when you understand that you're happy, it's because at one point in your life you've been sad. If you understand, so you have to understand both opposite emotions to understand that sometimes we have to go through some of that for our growth or for different things. But again, we get to choose what we make it mean of it, and we get to self-regulate. The point is not to not feel anything. The point is to have tools to regulate. And it's the same thing with ADHD. It's not that you can't focus. It's just that the executive function or that attention regulation is what is questioned, because sometimes we hyper focus on things we shouldn't be over focusing on, and that's why we spend 3 or 4 hours on something that it should have taken 20 minutes, but we were so passionate about it and we went down rabbit holes that you're like, how did you even arrive to that? But like you were chasing your dopamine and next thing you know, it looks like you're being irresponsible even though you really went deep into something.
It's going to be interesting to hear your lecture on it. So I definitely look forward to that. Okay. So I'm going to wind down the series, this episode, excuse me, and I invite all of our audience to join the Neurodiversity Conference. It is going to be taking place live virtually, and there is a speaker lineup filled with experts that are going to talk about neurodiversity, how we diagnose this. I invite everybody to join us. It is free while it's live only, and it's June 5th through the 7th of 2024, although you can always access it after the fact with a ticket if you're interested. Diana, anything to leave our audience with before we wrap it up?
The only thing I want to say is that you have to be willing to invest in yourself. Like if you do that, if you prioritize yourself, everybody wins. Like you show up better as a parent, you show up better as a colleague, as a friend. And while we have been taught sometimes that that's kind of selfish, it's really the sanest thing you can do. Because if you're not practicing self-care, you're in self-neglect. And sometimes we're not even aware that we're there because we think that's the norm. So everybody knows that you're the average of the 5 people you hang around with. So choose your tribe wisely and make sure you seek opportunities where you can collaborate with those that inspire you, and realize that, you know, social media can be a very good place to get inspired, but it can also become a place where you start to compare yourself. In this life, you should only be comparing yourself against yourself, where you were like, you know, 5 years ago, 10 years ago, and not because you're not there yet, because we're never going to be there yet. I hope you're never there yet, meaning I hope you keep exploring and learning and growing from a place of fun, and realize that you do have the answers. You just have to trust yourself. But please always ask for help from those around you, because we're not an island. We're not. We really need to lean on each other. So thank you so much, Dana, for having this network that really allows people to bring their passions in a way that is impacting those around us.
Thank you so much. I really appreciate that. And yeah, it's very interesting to be at the helm of it and to really watch different personalities come together, different endpoint goals come together, and to really try and figure out how we get that done. So thank you so much for those listening. Thank you so much for those watching. And thank you to Diana for joining us. And we look forward to the Neurodiversity Conference. Thanks so much for listening.